Hello, this is Dr. Wells from Wells Medicine, and I wanted to talk today about what to do when ketamine, TMS, nitrous oxide, stellate ganglion block, when interventional treatments aren't working. So there's kind of two situations. One situation in which the treatment was working and now is not working. And when patients come in and they've been doing really well with a course of treatments, and then the treatment is no longer working, we kind of start back at the beginning. And it's a question of, well, how long has it been since your last treatment? Usually the best results from TMS are within about a month. The best results from ketamine are about 3 to 5 weeks. So if it's been longer than a month or 3 to 5 weeks, then we know it's just time again for another maintenance. And if it's been much longer than about 6 months, then it might be time for 1 or 2 maintenance treatments close together, and then spacing them out to about a month apart again. So we can look to see how long it's been since the last treatment, and maybe we just need 1 or 2 maintenance treatments to kind of get you back to where the treatments are working. The next thing that we look at is any alcohol, marijuana, or benzodiazepines, because alcohol, marijuana, and benzodiazepines decrease the effectiveness and shorten the amount of time between episodes for depression, anxiety, and they decrease the amount of time that ketamine and TMS is effective. So if there's a lot of alcohol use or benzodiazepine or marijuana use, we may not get the 3 to 5 weeks out of a ketamine infusion. We may have to keep it closer to 1 to 2 for a little while until we can decrease some of those depressant medications like the alcohol, benzodiazepines, and marijuana. So that's the second thing that we look at. The third thing that we look at is any medication changes. So sometimes patients will come in and say, well, the ketamine's not working anymore, but they went off one of their antidepressants and now they're actually going through withdrawal, or they added a medication that is really flattening their affect and really making things feel not fun or not motivated or sedated throughout the course of a day. And so those aren't always even necessarily psychiatric medications. So the addition of like beta blockers, for example, beta blockers are great. They're a heart medication, but they can cause depression and they can kind of flatten things a little bit. So it's looking at all the medication changes that may have happened since the last time the medication or the TMS was working. And so, looking at how long it's been, looking at the addition of anything like alcohol, marijuana, or benzodiazepines, looking at any medication changes, either adding some or taking some away. And then the more subtle things. So did someone stop exercising when they had been? Maybe they go away on vacation or they get sick and they just stop exercising. Maybe they're busy at work and they stop exercising. A lot of people won't notice when they immediately stop exercising, but exercising really helps keep us feeling good. And so sometimes when a patient stops exercising, all of a sudden their mood will be subtly bad for that reason. Sometimes it's about the vitamins. Are you vitamin D deficient again or anemic again? That's a really big one. So when people stop taking their vitamin D or their iron supplements, or when people stop taking their magnesium and all of a sudden they're not sleeping again, sometimes it's a hormone change. So whether you're going through perimenopause or menopause and your testosterone is lower or your estrogen is lower, that can be a really big change where it's causing the ketamine or the antidepressants to not work as well anymore. Sometimes it's stuff going on in your life. Maybe it's, the ketamine's not working anymore. Nothing else changed in my life. I'm doing everything completely the same, but all of a sudden my boss is changing at work, or my job is changing, or I lost my job, or my dog died, or my mom's really sick and actually that's been weighing on me. One of the subtle things that I've seen happening a lot lately is on either side of the divide, politics is really weighing on people over the last several years. And politics as sort of the idea of a herd mentality. The news is super, super negative. So if you're listening to the news or on Reddit or on some of these social media channels, and there's a lot of negativity and a lot of anxiety, and the world is ending kind of discussion on these channels, there can be a lot of negativity and anxiety created in the the patient. Sometimes it's the anxiety and negativity in our loved ones. So they lost their job and they're going through a really rough time. And so that's wearing on us as well. So there's a lot of things to look at when the medication had been working and no longer is working. That's not necessarily that the medication itself is no longer working. One of the things that we see with ketamine that's really interesting is SSRIs, SNRIs, they build up tolerance really rapidly. And you see this with benzodiazepines too. When you push down on those levers, the GABA lever, the serotonin lever, your body tries to balance it back out. So a lot of patients on SSRIs will notice that the first 6 months is kind of this blissful zone or this blissful period. But after 6 months, it stops working quite as well. And then you have to rotate medications. So there's a lot of rotation to get the next medication that's going to work, or change of dose with the SSRIs. That is very typical of SSRIs, SNRIs, and benzodiazepines, but it's not typical of ketamine. So there really hasn't been shown that ketamine will stop working over time when given in the clinical doses and with clinical spacing. Now, this is a little bit different for the ketamine that's administered at home, because if you're taking it every day, ketamine tolerance can build up in that specific situation of using it every day, and then tolerance can build up, and that's really unfortunate for the patients for whom ketamine has been kind of the last resort that's really been the only thing that's been helpful. So that's one of the reasons I don't encourage taking it at home or taking it every day, because in the clinical uses, once every week or two after the first 6 infusions, every week or 2 spacing, we don't see that tolerance building up, and we don't see a resistance to ketamine. But if you're using it more often than that, you can see that. So when you're using ketamine every week or two to every 3 to 5 weeks, which is normal maintenance spacing, it should continue. If it worked at the beginning, it should continue to work unless some of those other things are kind of coming into play. Now, if the ketamine has not been working and you're getting to the 3rd, the 4th infusion, that's where we look at all of those other things kind of coming into play at the beginning and say, well, do we need to look at whether the medications you're on, what other substances like the alcohol or the benzodiazepines or marijuana that you're on, do we need to look at whether or not the diagnosis is correct, or whether there's some personality disorder elements in there that can be decreasing the effectiveness. Sometimes, especially at the beginning of treatment, it's a question of whether or not there's buy-in from the family, because sometimes even with the best of intentions, and not all families have the best of intentions, but sometimes even with the best of intentions, families will try to keep a family member in a box of illness so that the recovery might change the quality or the status of the relationship. And they just want to keep everything status quo. So there can be, some buy-in that we need from the family as well to allow patients to recover. So those are all things that we look at the beginning, whether or not the ketamine is working at the beginning. Ketamine has really great statistics. So for treatment-resistant depression, 70 to 80% of patients experience a 50% reduction of symptoms by the 2nd or 3rd infusion. So you've got pretty good odds of 70 to 80%, but that still leaves 20 to 30% for whom it just really doesn't work for. And I think science is still trying to piece together why that might be. Maybe it's a receptor defect in the NMDA receptor. Maybe it's a receptor defect for AMPA or mTOR. Maybe it's some biological downstream metabolite pathway. We really don't know yet, but it's definitely effective for 70 to 80% of patients, and that 20 to 30% for whom it's not really effective, we're still trying to piece out why that might be. But if it has been effective for you in the past, those are some of the things to look for why it may not be feeling as effective this time around.